Well, hello, this is Doug Sutton. I'm the Chief Strategy Officer with Hypervibe. And today we have a very, very special guest from Houston, Texas, Dr. Gigi Siton with Holistic Physical Therapy. And she's one of our specialists and experts in the physical therapy industry worldwide that's been using Hypervibe in her clinic. And today we want to talk about her background and how she's using Hypervibe in her clinic with her patients and any other insights that she may have. So with that, I just want to welcome Gigi and thank you, Dr. Seaton, for being on the call today.
Thank you, Doug. I'm so honored to be invited for Hypervibe because I've been crazy about this product for at least 12 years, maybe more extensively 10 years. I've been really happy about this. But first, let me introduce myself. I'm Dr. Gigi Siton. I'm a doctor in physical therapy for almost 30 years now. And I have my own practice as an outpatient holistic physical therapy in Houston, in Spring, Texas, close to Houston, for at least 5 years on our own. And Hypervibe is so big in our practice. We have 2 units, and Doug is so generous to give us the second one, the upgraded one. So we loved it. We couldn't have enough. And we all even joked that we should have more than 2. We should have 10 because then it really helped our patient. And so let me tell you about holistic physical therapy. We see a lot of acute and chronic pain. We see a lot of VA. We see a lot of pelvic floor. We're a manual therapy base, and we have acupuncturists in the clinic. We have manual therapists. We have massage therapists. So it's really, and we have nutritional therapy incorporated in our practice. We also have a lot of life coaches, psychologists, hypnotherapists, medical doctors. That is part of our team. So it's not just one way. It's not just a regular Western physical therapy intervention. We have so much. That's why we love the Hypervibe. Just kind of fits into our practice really well. The first time that I get exposed to the whole body vibration therapies, when I saw NASA was using it to help the astronauts reverse weakness and bone density reversal. We got so into it. I did my studies and I researched into it. I looked into it. It made so much sense to me, the way the technology is designed, because there's so much out there that's a whole body vibration, but it's a different, it's a platform. It's not the titter totter. And we did the research what's most effective, and Hypervibe came out the best product out there. So I didn't even know Doug. I didn't even know anybody. We bought ourselves a Hypervibe. We tried it with our patients, and first with the osteoporosis, because that was the indicated. That was the obvious reason on the website. But knowing me, I don't use things normally. I experiment. I design our protocol. Now we have ventured to PTSD. We see a lot of VA patients. It helps so much with PTSD. It helps so much with pelvic floor. It helps so much with scoliosis. We have a pediatrics right now. She's 9 years old. Severe scoliosis, 37 degrees with torsion. Now she's so much better. She's not in pain. It's so much easier to combine it with the scoliosis and postural exercise, especially knowing that the Hypervibe is going to loosen everything in the back so we can realign better. So a lot of our patients are really liking, and it's almost like they come for just Hypervibe, and that is our lure for them to stay with us because they feel so much better. If you look at my testimonial on my website, we had a lady that cannot walk for 3 years. She broke her ankle, and she's been to other physical therapies, and she couldn't do active range of motion. So what we did is we modified Hypervibe. We got her on this for 30 minutes in the beginning. And as she got better, she's less and less, and now she's walking on a walker. So she even said, if I have done the traditional physical therapy, it would not be this soon, and I would not be as high functioning as I am today. So I can tell you so much. When me and Doug, we can talk about it and see how much we're in it for. Even my high heel walking You know, it improves your leg and core muscles so you can walk on high heels longer. Just the 10 minutes is a best investment of your time.
Wow, that's a lot. Thank you so much for sharing all of that. So I'm curious then, Dr. Siton, when you work with patients, what's a typical protocol that you would use? I mean, there's so many different conditions that you and I've talked about offline that you use it with, including the ones that you just shared. So when you have, bone density or osteoporosis as an example, you assess a patient, what's a typical starting point and how you engage and what do you actually do with the Hypervibe? Is it just a couple minutes or certain positions? How do you work with it?
I actually modify according to the patient's capability. When they're
Mm-hmm.
so low level, like one of our patients, non-ambulatory for 3 months, when they're so low level, we start with about 10 minutes sitting on the platform. Their bottom is on the platform, not standing, not full weight bearing, just sitting on it for 10 minutes. That's all. And then the rest will be a bike, and the rest is range of motion. As they get better, we can progress at between 20 to 30 minutes on Hypervibe while performing exercises. So it depends how low they are, they come in. And on pelvic floor, there's certain positions that you can put them to really isolate the pelvic floor muscles. So it depends on their diagnosis and it depends on their goal.
Okay. And then different frequency ranges based upon their existing health conditions. So you range from what starting point to what other point?
They all start at the most minimum. They
Mm-hmm.
all start at the most minimum. And that's usually what I do in the first day is I put them on the 5 and for 10 minutes. And this is what I say. Tell me if it hurts worse or after the day after when we do this Hypervibe, because the whole idea is to make you feel better. And some people, they get dizzy. You know, we don't know that they have underlying vertigo and it stimulates their vertigo. They
Mm-hmm.
do that, they have underlying fracture and they didn't tell us. So we usually test for 10 minutes on the lowest level.
Okay.
And they come back in a day or two and they say, hey, it feels better. It doesn't make it any worse. And we always tell them the same and not painful is a progression. The thing we need to watch is if it's painful right after or 24 after, we need to know you're not a candidate for it, you know.
Yeah.
And so we have our own little precautions. If they have implants, the screws, or some metal in their body, in their bones, we kind of take precautions around it. We kind of tiptoe around it to make sure. And we tell the surgeons, is this okay? Is this something they can do?
Mm-hmm.
And surgeons usually don't know what it is.
Yeah.
And most of them will verbally say, try it, if it hurts, stop, you know, but at least we work with the doctors who did the surgery. So implants and screws and stuff, we're very, very careful.
Okay. Yeah. And then you just gradually build up from there. So that's a great way of approaching that.
Yes.
Yeah.
And acute pain, usually they love it.
Really? So from your expert perspective, what is the main reason why you feel that the results are being produced with the Hypervibe?
Well, I'm so passionate about the lymphatic system. And your lymphatic system is responsible for your healing, basically. That's the one. 80% of your vitamins are fat soluble, and water soluble is 20%. They all flow in your lymphatic system. So your lymphatic system supplies the muscle, supplies the bone, supplies the organ, whatever they need, whether nutrition, vitamins, or anti-inflammatory. So that lymphatic system has to have an open flow. Nothing has to stop that flow. Otherwise, healing doesn't happen. Energy doesn't provide it. So what the Hypervibe does, the whole body vibration, it shakes. Your lymphatic is not just under your skin. There's lymphatic around the muscle, inside the muscle, around the bone, each organ. It's like, think about it like around the saran wrap, enveloping each organ of your body. So when you're in pain, that saran wrap gets tightened up and gets clogged up because of muscle spasm or inflammation. What the Hypervibe does is gonna loosen it ever so gently, that allows enough channel to access for repair. And there's no exercise that can mimic that, because When you want to open lymphatic, you want to open the whole thing at once. You can't just isolate, oh, we're going to open just the legs. We can just open the arms, because lymphatic system work as a whole. Like, think about it as an engineer. You cannot turn on the car just turning on the front wheels. You cannot make the car wheel just turning on the back wheels. All of your engine has to be coordinated and open, and the plumbing and the thing of the car before the car moves. So like the body, you have to open all the lymphatic system in all parts with minimum pain and action and minimum effort. So this is the most efficient way to activate healing and repair. It's just that whole body vibration, micro vibration, especially because lymphatics are micro circulations. They're not the arteries, the big plumbing. They're micro circulation. They're designed to be activated in vibration and sound and movement. So when you're in acute pain and you're in hurt, major motion hurts. So the micro vibration of the muscle is the best way to channel all the lymphatic, or bring all the vitamins to the areas, bring all the necessary circulation to area. So the blood in the background will flow on the secondary. So we were taught in the Western medicine that you need the blood, the red blood cells, and white blood cells. They are the secondary. Your lymphatic is the primary. Remember when you bleed and there's a little see-through? That's the most important part, liquid. In Chinese medicine, that's why they work with the flow and all that, is that the acupuncture meridians. They say different names, but they all refer to the lymphatic system, meridian, whatever all they call that. This is about lymphatic system. So when you open something micro, I mean, the needles are micro. Imagine that. And then it helps the whole back. This same thing with Hypervibe, this micro vibration of your muscles opens up the whole system, not just one. That's why it's so effective in a short period of time.
Wow, that's amazing. So, and with that, so with the lymphatic system, there's a whole host of different conditions that actually contributes to. And I know you've spoken about PTSD, chronic pain, fibromyalgia, that it actually affects all of those.
Yeah, and they're not isolated. PTSD, fibromyalgia, they are kind of disease that is not one part. It's the whole body.
Yes.
So you cannot just say, oh, we're going to move your arms and it helps your depression. No, it's your parasympathetic nervous system. Your parasympathetic nervous system has so many satellites, and part of that is your lymphatic system. Your lymphatic system will respond to your parasympathetic. If it's calm, that's the rest and relax. The sympathetic is the fight and flight. That's when the muscle tighten up and it's in protective mode, and your lymphatic system will shut down because it's on that protective mode. Your parasympathetic is when your lymphatic system lets flow all the vitamins, all the white blood cells. By the way, your white blood cells flow in your lymphatic system too. And that's the fastest way. That's why in cancer patients, they always look at the lymphatic nodules, because that's where the scene of the crime of cancer, that's where your body is trying to kill cancer, is in lymphatic mode, your nodes. So that's where the first scene of the crime, that is not the cause of cancer, but that's how your body kills it, through your lymphatic system. And then if you do not kill it there, then it will spread. So that's your first line of defense. And that's why you want your lymphatic system to be opening, flow. And you know, it's like, it's the fastest way to activate the good guys, your lymphatic system. And that's a whole body vibration, because you're just there for 10 minutes and it shakes everything you own. If you haven't felt your lungs and your pelvic floor, get on the Hypervibe, you feel all those muscles. You know,
Absolutely.
There's no exercise that can, I don't care how you do core muscles, I don't care how you do that. Those are isometric muscles. You do not feel the micro muscles internally, because those are stabilizing muscles. So when you do the Hypervibe, you feel them all, because they're all activated at the same time.
Wow, that's amazing. So, and so with that, you see amazing results. It sounds like from the things that you've shared with me in the past. So, okay, so tell me about your relationship or your experience with the proprioception relationship between using Hypervibe and working with your patients and the results and outcomes you've seen.
Well, I'm glad you brought up proprioception because I forgot about that when I brought up lymphatic system. So I want people to know that when you treat the body, you cannot really, it's when I was taught in Western medicine, we were taught on reductive, like one at a time. You do this and then you fix this. But essentially your body doesn't work that way. When you're stimulating the lymphatic, you're also stimulating the proprioception, you're also stimulating the red blood cells, you're also stimulating the arteries, you're also stimulating the venous circulation. So you're asking me about the proprioception that is closely placed where the lymphatic system is. It's also in the superficial and the deeper part of the muscle. Let's define proprioception. It's the sensory feeling, that knowing where the position of your joint without even looking. Like right now, my arms is sideways. I know exactly where that is, even though if I'm not looking, because the ends of my fingers is telling me my position. So without the visual input, it also tells you where your body is. So that really helps because most people now are very visual oriented, and that minimizes their proprioception sense. It doesn't make it more efficient. So with the Hypervibe, with the extra stimulation during vibration, your lymphatic has so much, think about it this way, it all happens at the same time. When your lymphatic is increased the circulation, your arteries and your veins increase circulation, then your muscle has so much circulation, as well as your nerves, and your proprioception becomes activated, more heightened in a short period of time. So that's why your proprioception also improves, because your sense of position is also being increased circulation in that area.
Wow. Yeah, that's amazing. I know from my own personal experience, having had a spine surgery, that the Hypervibe was a catalyst in my recovery, and the level of balance that I have today and flexibility is beyond what I had when I was in my 20s. And I just know from my own personal experience what a catalyst the Hypervibe has been for me as well.
No, and I can tell you why the flexibility also improves, because the flexibility is from at the end of the muscle, the muscle bulk, and then the tendon at the end.
Mm-hmm.
That's the rubber band that connects to the bone.
Mm-hmm.
That rubber band there has only water and fat that circulates around it.
Mm-hmm.
That's why it's white. It's a tendon. It dependent on the hydration and your essential fatty acid. That's the main ingredient for flexibility. Now, even if you have well nourished about that, the only way that tendon can function again after injury, after surgeries, because it tightened up from immobility from the surgery, you're laying down, that rubber band gets tightened up.
Yes.
It's like when you shake it like that, it's the most efficient. If you stretch a very tight tendon, you're going to break it.
Right.
You're going to break it.
Mm-hmm.
So when you hydrate it, of course, in my clinic, you have to have hydration. You have to have essential fatty acids, because that's what part of holistic physical therapy. Once you get the raw material in that tendon and you shake it slowly, you can, the hydraulics works.
Mm-hmm.
And that hydraulics kind of nourish each fiber of that tendon. Then they become flexible. Then they become a good shock absorber. So you shake it first, and then you strengthen it with the weights.
Oh,
so
wow.
most people, they just strengthen it without even strengthening the tendon, and that's why they break. I said, oh, I'm very strong, but I can't move, and then they tear the joints, because they forget the flexibility part. And that flexibility has to have hydration with water, good fats and essential fatty acids. And then it's like a shock absorber in an 18-wheeler car. If that shock absorber is not strong, that 18-wheelers can go somewhere, but
Right.
not very efficient. So that tendon right there, that's the connection between, and that's not just the end of it. In the whole of your back is tendon. So a lot of your back people are dehydrated and low fat diet.
Mm-hmm.
So you need to have a high good fats and essential fatty acids so that flexibility is there. And so what the Hypervibe would do is you get the raw material, then it shakes it slowly, ever slowly, that it allows the divine intelligence of that tendon to stretch to its maximum range. So
Mm-hmm.
when you're ready for exercise after, it's ready for you.
Right. Wow. Yeah, it's amazing because we've seen, and I'm sure you've worked with patients that are young and old alike. We've worked with elite level athletes as well as elderly patients that are, practically in wheelchairs, and they have a very difficult time moving around. And it's the same mechanisms that's working. It's just applied to different body types and different states of health.
Exactly. And that's when I realized how, like, for an older person who hardly walk or on the wheelchair, you can't exercise that person right away.
Yeah. Yeah.
It's not going to give you the most benefit. So
Mm-hmm.
what you do is you're going to put them on the Hypervibe. You kind of shake them off, like it's like you're shaking each joint
Mm-hmm.
before you move them, because you're hydrating them. And besides, the side effect of Hypervibe is it also produces endorphins. So
Yes.
they feel good about the experience. So when you have endorphins, it's like it increases your oxygen uptake, it increases your well-being, and you're happy. And so it has so much benefit just by starting off with Hypervibe.
Yeah, we've even seen, and for corporate wellness, we're in corporate environments such as the Google corporate headquarters, and they're even using it just for 2 to 3 minute breaks in the middle of the day for employees, and it does activate their endorphins. It gets their blood and the oxygen flowing in their body, so they're more productive when they go back to work. So, whether you use it for 10 to 30 minutes for a full workout or a full routine, or just a couple minutes, a lot of people see value even in a short amount of time.
Yeah, because your lymphatics doesn't need a lot of work. It's
Mm-hmm.
your body is amazingly designed so efficiently
Mm-hmm.
that if you just keep your lymphatics open and keep the circulation open, it can do anything for you. It will heal colds very fast. It can fix anything, broken arm, injured arm, muscle spasm, post surgery. It can do anything for you. It's just saying, when you drive a car, you go
Yeah.
to a freeway. If the freeway is clogged, you can't move that car. That supplies to go to one point A to point B.
Yeah.
It's not gonna move. But if you keep the freeway open, it's just an efficient flow. That's like lymphatic system. That Hypervibe keeps that flow open all the time. So all the efficient communication between your proprioception, your spinal cord, your lymphatics, your white blood cells, your vitamins is 80% water, so fat soluble. So that goes through your lymphatic system. So even the vitamins uptake is there.
Wow. Yeah, that's amazing. So I'm curious then, Dr. Siton, what percent of your total patients use Hypervibe? And then is it something where you have them use it prior to your normal treatments and at the end, or is it at the beginning or the end, or both, or how do you actually use it, and what percent actually use it?
100% use it. I would
Wow.
say 110 because the employees use it too.
Yeah, yeah,
We use it for us too.
yeah.
But 100% they have to use it.
Mm-hmm.
And then we use it, it depends on the patient.
Mm-hmm.
Usually, just because ideally I would have made them use the first right away, but we only have two, so we take turns.
Mm-hmm. Yeah.
The most of them will do it after, just because that works with the patient as they come in. Somebody was already standing on the Hypervibe, the two is already booked, so we can't do that right away. So
Right.
they do their warm up, but ideally I would start off with that.
Okay, so it sounds like we actually may need to get a couple more Hypervibes in your clinic so you can. Okay. I'm reading between the lines here, so yeah.
No, but I'm not saying just to get one, but I'm just letting you know that's what's gonna happen when you have a Hypervibe, because everybody wants to be on it.
Yeah. So yeah, we've even seen for high-level athletes that they use it immediately after exercise to help clear the lactic acid out, so their bodies recover quicker from the
Now,
exercise.
it prevents lactic acid accumulation if you do it first, because the flow is open.
Oh wow. Okay. So
Yeah,
before
so
and after then.
Yeah, and before it, and then the lactic acid, if you look at the biochemistry of it, if you take it with a sea salt, Himalayan sea salt, I don't know if you read the book, The Salt Fix, you won't even have that lactic acid accumulation. If you do the hypervibe combined with the increase with the water with sea salt, you don't have the lactic accumulation because that lactic acid doesn't accumulate. It's neutralized by sodium chloride in the body blood.
Oh, wow. Okay. So another question I have is relating to the safety of the hypervibe. There's some people that are like, oh my gosh, there's such high levels of G-force that you're being exposed to and acceleration. And what a lot of people, and there's research studies that validate that even walking or running, your body is exposed to even higher levels of G-force than what the hypervibe has. So I want to speak into, or have you speak into, your perspective about the safety of the machine, and then also the planes of motion and why specifically you chose hypervibe.
Well, we'll talk about the G-force first. You're right. Walking is like G10, by the way, on pressure on your joint. You're not going to even do that in hypervibe in the clinic because it is so isolated that we can harvest the G-force lower with maximum stimulation. You don't need to walk that much as running to get that G-force because we're focusing on lymphatic and microcirculation. That's why it's so efficient. You have to start it from the basic. If you want to rebuild the house, it's a brick house, you want to rebuild it one brick at a time. So with a hypervibe, you want to progress at one G-force at a time. You start with 5 and 6 and you progress. So I'm not even going to go to G17 right away. You're not going to go run the marathon right away to fix your calf muscle.
Right.
So this is the reason why I like hypervibe, because you can really accurately do the progression, quantify the progression on the G-force under your control. Instead, if you make a person walk right away, they can't fight that G-force of 10 when you're walking because the muscle is still weak to fight that gravity. That's why people can't walk. That's why I like hypervibe, because you can slowly introduce gravity in an incremental motion, in incremental level, and increase the circulation until they can really walk on their own.
Right,
and
exactly.
The reason why hypervibe is so much better than exercises, because range of motion on the bed doesn't really mimic gravity translate into walking. It's a totally different dynamics. If you look at the dynamics, the angle of that to translate into function, range of motion in the bed doesn't even go as close to what hypervibe can do.
Right. Wow. Okay. And then the other thing, and again, I love that too, because a lot of other, the research suggests that it's important to be able to have the lower frequencies and amplitudes, so the lower levels of G-force, as well as the highers, and be able to progress. And, really there's the original technology that was first exposed to that the European Space Agency and NASA was using, and Hypervibe are really the only platforms, to my level of awareness, to have that level of range from the low to the high that you can actually go to.
That is not fair to compare, because they're talking about astronauts.
Right.
They were studying astronauts, and they've been through a lot of training and they're not looking at our patients that non-ambulatory, broken ankle, on the wheelchair, 91 years old. They don't have that thing. So we can't really go to the high gravity yet. But I can tell you, I have 91-year-old, 81-year-old that after 6 to 8 weeks with me, they can tolerate that because you build towards it. You build towards it. I have patients that they beat me in any time, because when they get on the platform, when they're higher level, we do their exercises on the platform, single leg, do all that with weight. They can do all that because you prepare them for it. You prepare them progressively, quantifiably, do your progressions. You can do that. It's possible, but not on the first 8 weeks.
Of course, right. Depending on the age and the condition of the patient that you have. So, but at least with the Hypervibe, you have the access to the full range, so you can truly meet people where they are and then progress them along the way. So,
and even for obese people, for morbid obesity, they can do range of motion. They can do that. They can even lift their own arm. How much more doing a range of motion? So what the Hypervibe does is doing the microcirculation under muscles while they're sitting.
Wow.
And they can stand in the beginning because their bones are so weak to carry their weight.
Yeah. Yeah.
And then we haven't even talked about what it does to the bone itself. You know, my background is, I forgot to tell you about my background. I have some training in engineering. So your bone is your structural support. And that microcirculation activates your osteoclast, you know, osteobites and osteoclasts. It rebuilds and breaks down the old bone and stimulates the new bone. So that alone will strengthen your bone. So if you're obese or a fragile or osteoporotic patient, just being on the Hypervibe strengthen your bone right away, because that's all it needs. A little shaking with the recipe of the gravity, your bone cells activate and alive. They go, oh, okay, we're gonna make more bones. We're gonna get rid of the old bones. It's called bone remodeling. The bone remodeling on Hypervibe is so efficient, and the patient don't even realize that after they come and visit, they're able to tolerate now sitting. They're going to tolerate standing. And then once they're standing on the Hypervibe, it can translate to walking. So you can go straight to walking without building your, not tendon. We're not even talking about tendon. We're talking about the basic structure of the bone. When you feel the bone, when you feel that senses that gravity stimulation, it will remodel itself. It will efficiently get rid of the old bone and made new ones just because of that vibration motion alone.
Wow, that's amazing. So does it also support with bones or joints that have arthritis as well?
Yes.
Yeah.
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 So what happens with that is most patients, arthritis, by the way, is dietary.
Mm-hmm.
So when you don't eat well, you get arthritis. It's not because of old age, because we have arthritis at 9 years old and 8 years old here. So it has nothing to do with age. Back then, it used to do with age because people ate well, and then as they get older, they don't eat well anymore. So arthritis happens.
Mm-hmm.
But now arthritis is any age because of bad diet. So back to the diet, that raw material, if you have good raw material, you can reverse arthritis.
Wow.
And with the help of Hypervibe, it can really rebuild your bone.
Mm-hmm. So another important distinction with the Hypervibe technology, and I know you and I have spoken into this offline, is the plane of motion between the linear platforms, that there are some of those out there where the entire platform goes up and down together, and versus the pivotal, which is why Hypervibe designed ours this way, was based upon the research and the movement of the hips and how that actually works. So from your perspective, going back to why you chose Hypervibe instead of all the other types of platforms out there, part of that was plane of motion. So what's your perspective on that?
I mean, it's a smart design. Human bodies never to jump up and down. That's the platform. It's like jumping up and down. You can only do so much of that, but that's not functional. Your body's designed so the alternating motion, the teeter-totter, it mimics the teeter-totter. Your brain left and right it's always designed this alternate motion. Any locomotion, even running, is alternate. We are not kangaroo. We don't design into jumping. We're designed into alternating motion. So that mimics, Hypervibe mimics the alternating, teeter-totter motion. So that, I thought, that's the most micro alternating motion in your body. And that's what you started with. The micro teeter-totter, the micro motion of the tendon, the micro motion of the bone, the micro rebuilding of the bone is a much better design than all the platform, the jumping up and down, because that's totally different action to your brain.
Right. Yeah, makes complete sense. So now I know that there's, speaking of the functional training, there's some other alternative uses that you've had and you use, including a book that you've written, about, even wearing heels on the machine, and then some other alternatives. So please share your perspective on that as well, and with the functional training aspect of it. I thought that was so interesting.
I can start with my book. I write the book, The Sexy Art of High Heel Walking. What it's about is, it's never about the shoe that you're wearing. It's all about your body, how strong your legs, how strong your core. And it's all about that. So using the Hypervibe on high heels, it really kind of specializing the muscles you need on high heels to get strengthened, to be on high heels 14 hours, 16 hours like I do, and you won't hurt because it improves your core, improves your leg muscles. And so what with my patients in the beginning, we use them without the heels, we use them with the balance, and we put them the hypervibe. And so once the core and the leg muscle strong, we put them on heels and on the platform to make sure that they can keep their balance, whether the unstable surface underneath. And that's how the magic of a hypervibe, because it mimics that unstable surface like you're walking, but you're standing there maintaining your balance. Once you master that, you can translate that to a functional training. So when you walk on the in a flat surface, you're ready, your body's already trained to accommodate that because you already trained it on the hypervibe safely.
Wow, that's amazing. It makes complete sense. And it's one of the things that even when I spoke with the founders of Hypervibe, we were blown away by what you discovered with that. And again, the science makes complete sense. It's just something that we hadn't actually thought of before.
Yes, and most people, they're just so focused on, the action of high heels, and they miss the point. High heels really strengthen your core and your leg muscles. And so we kind of teach them that and make them feel their core and their leg muscles while on their hypervibe. Because once they make the connection between their brain and their core and their leg on the hypervibe, on the high heels, when they get off the hypervibe and on the flat surface on the ground, they activate it more. They do it much more efficiently, pain-free, and they can do it all day because they realize, oh, these are the muscles to be activated that you keep telling. I mean, I'm sure before the hypervibe, you keep saying, oh, I work out my core, and then I asked them, have you felt your core? Oh, this is like, no, honey, that is not your core. That's just the cover of your core. Yeah. Get on that hypervibe, and you're gonna feel every core you ever own. And yes. They get on the bike, oh, that's a core. I said, that's the core muscle, not the feel that you do sit up. So the hypervibe can really make people connect and isolate that core muscles better so they can translate the functions to high heels to whatever.
Yeah, that's amazing. To your point about the core, I know that from personal experience. I'm in my mid 40s right now. And even when I was in my 20s, when I was doing yoga, I couldn't do those postures where I'm standing on one leg and kicking my other leg out. And now I can put my forehead to my knee with my other one out. And I can stand there for what feels like days. And I have balance, and my core is so much stronger. And I didn't realize what I thought was my core before versus what the Hypervibe does. And there's no other form of exercise that can give you that access.
No, and that connection makes it so efficient to perform an activity.
Yeah.
Once you know exactly what muscles you need, and the Hypervibe gives you that connection loop. It gives you that connection loop to your brain. You tell your brain, I need my core, and you know exactly where you're going. And so we talk about the proprioception. It hyper activate that proprioception. Now you can stand on one leg and you become very efficient in your balance because it strengthened it by a hypervibe.
Yeah, absolutely. And one other thing that you brought up in another conversation that we had that I think is important for the men out there, especially men as they age. You had some really interesting uses for it to treat specific conditions. And I thought I'd have you have the opportunity to speak into that, because it seemed like an alternative to using some form of medication or other type of substance that people could use and still achieve amazing outcomes.
So I'm a pelvic floor rehab therapist. I see men and women. Since you mentioned men, this is very interesting. The physics and the plumbing design on men. With any plumbing, it really slows down. Gravity affects it, and diet affects it, hydration affects it. It's basically your pelvic floor is relying on hydraulics. It's plainly hydraulics design. And with any hydraulics, without the water, without the plumbing, it doesn't work. So what the Hypervibe does is it loosens all the plumbing, the microcurrent. We're talking about the microcurrent that supplies your pelvic floor, especially on men. It opens up again. And we have so many patients that said, why didn't I know this? And no, drug companies has been trying to copy the microcirculation on that area. But the problem is they open all the microcirculation. That's why it causes heart palpitation, stroke, because it opened the brain too. But what the Hypervibe does, it opens it mechanically, like the mechanics of it opens, but it makes it more efficient also. That's how it should be, not by drug induced. So it's more on the normal progression of healing, and in a more long term, it stays longer, forever strong with the Hypervibe than just the pharmaceutical way of opening the circulation. And not to mention, that's just the first thing on Hypervibe on the pelvic floor. It opens it up. The second one, it becomes more efficient, because with the isometrics in Hypervibe, you're gonna, you contract.
Yep.
Normally, as you get older, you don't know how to contract the muscles anymore because it gives into gravity. What the Hypervibe does, it contracts the pelvic muscles and then relax and contract. That's actually how it should work. Then it becomes very efficient. So when you have the isometrics and relaxed mechanism on your pelvic floor, it pumps your hydraulics. So when it pumps your hydraulics, everything starts to work. All the nutrients, the blood circulation allows the flow again in your pelvic floor. Then you back to restore your function forever.
So with a man, you would have them sit on the machine, and for how long? What would you typically recommend?
As usual, at the beginning, just 10 minutes to test, because usually when I see the men already on this, they already went through medications. They already went through trauma, and they already surgeries. So you have to go slow, because you cannot just open up blood supply, because it will hurt them too. Right. So you have to make sure that the plumbing is capable to be opened up. Yep. We go slow. I do manual therapy, we do acupuncture, and we do the dietary modification, because I'm a believer, if there's no raw material, there's nothing there I can work with. Right. So they have to change their diet, because just even the sugar or the caffeine, it will cut the circulation in your pelvic floor, because the caffeine affects the contraction of your smooth muscle cells. So what is your smooth muscle cell? It's in your heart, and it's in your pelvic floor, and it's around the penile muscles of the men. So if you're having high caffeine, I can't really open that microcirculation, because it makes it into spasm. Caffeine spasms that. So I cannot do that. So we have to modify the diet first before I get on the Hypervibe, because we have seen that, they get on Hypervibe, they feel good, but then it boomerangs and makes it worse.
Right. Okay.
So you kind of have to design that you cannot compete with the chemical spasm stimulation on that area too, because Hypervibe is so efficient in opening it up and strengthening it up. And if you have some pharmaceutical or artificial thing that opens it up too, it's gonna, it's worse. It will make it worse, because it crashes the blood from the brain and more there, and you don't want that.
Yeah. Okay. So your also recommendations, I know you've had a number of patients that you've recommended, and they've actually purchased home units for themselves, and you can help guide them. So have you found that that's a successful approach to work with your patients? And, they still have a relationship with you, of course, you're guiding them, but then just the ability to have that at their home to use every day.
I mean, if I have my way, everybody should have one at home.
Yeah.
Because you're going to face gravity, you're going to wear and tear your body. This is the best way to help your body repair on the wear and tear. And so most of my patients that can afford it, they buy it. They ask me, I actually have one right now that we're trying to get her a unit, because I said, you need to have a Hypervibe. You can't come here every day. You need to do this at home twice a day. And especially with the PTSD, it produces the endorphins, and it relaxes their muscle, it relaxes their body. They can cope with stress better, and then eventually the PTSD doesn't have a power over them anymore, after I noticed about 6 months on the Hypervibe.
Wow. That's amazing.
Uh-huh.
Well, I really appreciate your investment of time today, Dr. Siton. Is there anything else you want to share, any other perspectives that we may not have talked about?
We talk about low back pain, like your experience. We talk
Mm-hmm.
about the ED. We talk about we can talk about the female pelvic floor
Sure.
because we have a lot of bladder incontinence,
Mm-hmm.
and that will help the bladder contract too, because the bladder has to be supported with the pelvic floor muscles. And so when the pelvic floor muscles strengthen, the suspension of that bladder again is so good that
Mm-hmm.
it can contract and relax much better without, we have a lot of testimonials that they don't use diapers anymore. And these ladies have
Wow.
been using diapers for 21 years.
Wow.
Or with our pelvic floor. I do the manual therapy stimulation. They do acupuncture, dietary changes, and hypervibe. It's like a 3-leg solution, not just one. So when we have all these three together and it's being applied to them, you can completely reverse bladder incontinence.
Wow. Yeah. I didn't even realize it was such an issue. So that's amazing.
And 40% of women have bladder incontinence.
Wow. Wow. And so this is a great thing to have in the home and to be able to use every day for that amongst so many other different conditions.
Yeah, besides childbirth, that will affect your pelvic floor. Increase intake of caffeine in your diet affects
Mm-hmm.
your smooth muscles. And we have younger and younger kids now drinking the Starbucks coffee with caffeine at 8, at 9. By the time they reach at 22, they have bladder incontinence. I'm seeing them younger and younger. I used to see them 50s and 45 after babies. Now I see young 20-year-old college kids have bladder incontinence and they have no idea where it's coming from, and they don't realize, not everybody, but these people are sensitive to caffeine. Their body cannot metabolize it and accumulate in their smooth muscle cell. So some people will have palpitation in their heart with the caffeine. Some people will have bladder incontinence and they don't know why. And more likely that's because they're sensitive. It weakens their pelvic floor muscles.
Wow. Wow. That's amazing. Well, really appreciate the investment of time today and your willingness just to share so openly about your experiences with Hypervibe as well as about your specialties and area of practice. Is there any things you have upcoming? I know you have a number of speaking engagements and you've got a book coming out. You already have a book that is out. So just how people can find out more information about you.
So I wrote the book, The Sexy Art of High Heel Walking. Let me show it to you. There you go. Come, you plug it in.
All right. Yes, absolutely.
Yes. And then the second book is about applied epigenetics. And the title of the book is Your Body is a Self-Healing Machine. And on that book, there's a whole page about whole body vibration, about the Hypervibe experience too. I've put that on that one chapter of that.
Wow.
And so that you can find all this information on holisticphysicaltherapy.com or www.gigisiton.com, because of my personal page, all of that information there. And I'm going to the Philippines and I'm going to see some lecture there in the College of Medicine. And then when I come back for a month, and then we'll see if my upcoming TED Talk, and then with the Epigenetics Conference with Bruce Lipton. So this is an exciting year.
That's amazing. Well, we're very grateful to have you as part of the Hypervibe family, and one of our just absolute industry experts has been using this, and so grateful for your experiences and your willingness to share and help make a positive difference within this industry as well, and all medical professionals so they can have that opportunity to learn from someone like yourself.
And I would like to correct you. People always call us alternative, the Hypervibe, the whole vibration, body vibration. It's not an alternative. It is it. Yeah. The alternative is medication. If this doesn't work, then you need medication. But right. Try this first. This is first. The natural way of doing the Hypervibe, doing the whole exercise, doing your diet. And then if that doesn't work, then try medication. So they're the alternative, not us.
Sounds great. Well, thank you so much. We appreciate it. We'll have links below here as well with all of your contact information so people can learn more about you. And we really appreciate that and hope to talk to you really soon.
Thank you, Doug, for inviting me. It's so honored. What amazes me is it's not like you you found me, and then I used this Hypervibe. I found it first, and
Yeah.
then we found each other. So
Yeah.
this is really good, you know, that I
Yeah.
did it on my own, and how your product spoke for itself. That's how I found you.
Yeah. I appreciate it. All right. Thank you so much.
Thank you. Take care.
All
Bye-bye.
right. Bye-bye.